Everything they said was lies. So the one point that was made by the negatives over here was that why penalize everyone for doing these like simple pleasures? Well, the thing is, we are all being penalized for these simple pleasures. More than 1/3 of U.S. adults are obese, or 34.9%. 78.6 million Americans are obese, and this was from the Centers for Disease Control. And according to the article, should we tax soft drinks? That means that the medical cost of obesity is $147 billion per year, and half of it is paid by Medicaid and Medicare. That means we're all paying for it. And then they mentioned about simple pleasures, it's just a soda here or there, but well, drinking just one 20-ounce bottle of a sugary beverage per day can result in gaining 25 pounds per year. And that is according to an article by the Boston Health Commission, Health Effects of Sugary Drinks. One of the things they touched on that I agree on is that people need to be informed. According to Dr. Kelly Brunel and Dr. Thomas Farley, in the article, The Public Health and Economic Benefits of Taxing Sugar-Sweetened Beverages in the New England Journal of Medicine, several market failures exist with respect to sugar-sweetened beverages. First, because many persons do not fully appreciate the links between consumption of these beverages and health consequences, they make consumption decisions with imperfect information. And these decisions are likely to be further distorted by the extensive marketing campaigns that advertise the benefits of consumption. Another thing they touched on was that it would hurt, that only like wealthy people would be more obese, or that it's not beneficial to poor people, that it would hurt poor people. According to that same article, Should We Tax Soft Drinks? Research into the impact of taxes on soft drinks reveals that such taxes have the potential to be most beneficial to low-income people, particularly because obesity is a regressive disease, disproportionately affecting poor minorities. Another piece of information from that is that soft drink consumption is rather elastic, such that a 10% price increase would amount to about an 8% drop in consumption. That's conservatively. Some reports from Coca-Cola and Pepsi actually report on an even higher effect on price increases. Very small taxes have not shown that they have a great effect in some settings, but even small taxes on beverages in some states show significant impact on populations that are most at risk for obesity from sugar-sweetened beverages. And the article that I mentioned earlier about Mexico, they actually showed the greatest drop-off amongst the poorest by, in that 1 year, about 17% of the population had, or 17% drop in purchase of these sweetened beverages. Another thing they touched on was that cigarettes are actually quite elastic. According to Dr. Engelhard Garson, Reducing Obesity, Policy Strategies from the Tobacco Wars, a large body of evidence shows that smokers are fairly sensitive to the price of cigarettes. Young smokers and those with lower incomes are most sensitive to the price. Amongst low-income smokers, for example, each 10% rise in price leads to a 10% less smoking. So, in conclusion, the taxing of sugary products, while it would be expensive, and they mentioned butter, but butter is actually one of the products that hasn't shown an increase in regards to inflation over the last 30 years, whereas soda has shown a decrease. So I think the evidence is pretty clear that sugary drinks, or sugar in general, is a large contributor to obesity. Thank you.